I would say since the birth, it's not been the best. I'm still, we're 10 months on now. I'm still waiting for birth stories. I still don't know what happened when I gave birth. I know, obviously, I was in intensive care. I know vaguely kind of what happened. I know I have psychosis, so I was sectioned as well. Couldn't really tell you much else. I'm still waiting for birth stories, and I would say that 10 months on, I've only got an appointment next week with a psychiatrist about some EMDR therapy and about medicating. And on the 1st of every month, I email the perinatal mental health team and ask for help and tell them that I'm drowning and tell them that I'm not coping. And I don't often get a response, to be honest. I personally have to manage my mental health really well. I've got quite a few different diagnoses, and I have to be really switched on for mental health. And when I'm drowning, something needs to be done. And it's been 10 months and I still haven't got the care that I need. So that's not the best.
So for me, during my pregnancy, I didn't experience any signs of mental health issues at all, or they weren't clear to me that was what was happening. There were days when, I felt like I was going to, and I needed mental health, but the doctors and nurses don't really pick up on it. And then after giving birth, my son has been born with so many difficulties. So straight away, I almost felt as if I was just given my baby and just was told, right, go home, look after him, that's it. I would have liked to happen was someone to reach out to me to say, look, your son is obviously not feeding properly, he's born via a C-section, you've obviously went through a lot of stress on the day you were in labour for 72 hours, is there anything that you would like to discuss? I didn't have that at all. And then my health visitor came home, and even when she came home to see me, she kind of said to me that, oh, you're not feeding your son properly, which, bearing in mind my son's been in and out of hospital since he was born, that's not something I want to hear, where you're telling me you're not feeding your son properly at all. Help me. What you should have done was say, I think you should be feeding him this way and help me a little bit, rather than turn around and going, you're doing it wrong. I think you need to put your son straight to hospital. What you should have done is notice that this woman has had a C-section not 4 weeks ago. She's obviously alone. Her husband's at work because he works nights and stuff, so he's always working. She's living on her own at the moment, and you didn't point. I was showing you signs that I wasn't happy or I was going under. My mental health wasn't there at all, and you basically dismissed it.
Last year, I lost a baby. I was pregnant, and the first was like natural abort.
Yeah.
I was 5 weeks, and I went to the emergency, and there I didn't have too much support. They sent me, it's okay, if will happen, you need to go home and stay home. After 1 month, I get again pregnant, and in June, I was 4 months pregnant, and I made the analysis, the test, and my baby was with Street syndrome, Edward and Patos, and I need to stop the pregnancy. I stopped my pregnancy, but after this, nobody called me and to say, are you okay, to support me for mental health, and to say something to me. Nothing. And only midwife called me one time and say, you okay now? You need to be strong, something like that, but others no. There was a doctor, I don't know what was, nurse, and I said, can you help me to know more about what can I do? How long can I stay to wait for another baby? Or I need support, like emotional support, mental health. And she said, she gave me only one link to go online to see what can I do, and nothing else.
Because I know what Katina was going through. To be honest, she was really bad, and she didn't get support from no one. It was horrible time for her, And even yesterday when we have the chat with Katrina, I told Katrina, you have to talk about that, because this was really, really bad time for her. No one support for her mental health. No one care about what is going on.
When I came to UK with my ex-partner and my 3-year-old son, I was 10 weeks pregnant. And then on the second day, I got miscarriage, and I was freaked out because I really want to conceive, because I lost one of my son last 4 years ago. I wasn't aware at all about the mental health situations, because in my country, it's not something that we want to admit or we want to talk about it. So we hide it. So I've been in the dark for quite long. I've been in the abusive relationship. I didn't come to UK voluntarily. So somehow I got miscarriage. So it hit me pretty bad. When I'm pregnant, I just scared. I have trauma that I'm going to miscarriage again. The nurse in urban house in the refugee camp start to ask me about my mental health conditions. She realized that I've been struggling with my mental health condition, and she explained to me about the medication that she would like me to try, and she really want me to give her a favor. And that's the word that I'm the kind of person that I could not say no. So I really feel like okay, I will give you a favor. I will try the medicine. Within the 3-4 days, I struggling with the medications, and I don't like it. But because I still in the refuge camp that time, I went to her again because I thought that I want to I get angry with the situations. And then she told me to be patient and try to give more time for the medicine to adopt with my body. Then on the 4th day, I start to feel better. In my first trimester pregnant that time, I refused. Somehow I want to tell here how she keep approaching me without giving up on me. I was agree to her to join all this activity that she refer me only when I was 7 months. So I was feel like what a waste. I've been wasted my first trimester and second trimester. When I joined at Rose Antenatal class, I was really, really thrilled, and I was really excited. And I also learned how to connect with my baby. As you know, I've been pregnant before 7 times, and a high risk mother with a mental health conditions. But when I in the class, I got so much information, and especially about the labor positions that I never experienced in my life before. So my midwife also have referred me to the few therapies during the session to make me relax. So I feel care. I really cry during the pregnancy because not because of not getting help, but I got help, and this is the help that what I need.